The inspiration behind setting up a CEPN is really just to ensure that we really think very hard about developing a workforce based around the needs of a population, particularly as our population is getting older and some of the demographics are starting to change, and also as service models are starting to change with much more care being provided out of hospitals. We need to think of an alternative to training in a hospital for a hospital, which is what a community education provider network is meant to do. So what's involved in setting up a CEPN, if you're doing it from scratch, is really to bring together a network of providers around a common purpose. And the common purpose in this case is workforce development, education, training. That's important because in order to create networks and potential federations, you really need to have a clear purpose identified as to why people are doing that. So the first step is to think about the purpose, in this case workforce development, education, training, and then to establish a network based around that purpose.
Well, I was first approached about the idea of community education provider networks something like 2.5–3 years ago, before they had been developed by Health Education South London, by two GP colleagues who had really invested a lot of thought into how to improve the infrastructure of education in the community to meet the needs of community and primary care. The principal at St George's and I were enthusiastic about the idea at the time, and as time has moved on, community education provider networks have become a reality, and they provide a fantastic opportunity for an understanding of workforce needs, training needs, much closer to the ground than we've had previously, and the infrastructure as they go forward to deliver the education that's needed for the modern NHS workforce in the community.
Okay, well, when we first came across the terminology of CEPN, I had no idea what they were talking about, and I thought, well, another acronym, well, how am I going to deal with this? But when I thought it through and had looked at some of the original papers, I thought, wow, this is a really good idea. For me, it felt like this gives us the opportunity within primary care to develop a workforce in the way that we feel that we need to develop them. And I guess when I'm looking at, I'm a nurse by background, and when I'm looking for courses for nurses in primary care, I look to our the universities locally. And I think they're sending out courses which are totally inappropriate to what we need to deliver our patients' needs. So we've got patients with long-term conditions, for example, dementia or whatever, and it's real kind of basic care, but it's a generalist care. And so we need courses that are actually people that will equip people with the skills to deliver the right care in the right place. And I thought, this is a great opportunity for me to be involved in this, thinking that if I know best, which I guess I've been around, I've been a nurse a long time, I've been in general practice a long time, and I think I've got an idea, and that's my kind of clinical expertise to say this is what I think we should be doing for patients. This is hearing what patients are saying and thinking this is how we should deliver that need. So the CEPN then, for me then what it was meaning was like, okay, well this is like a little laboratory within primary care, so this is our university within the community.
So, in the outer South East London boroughs of Greenwich, Bexley and Bromley, one of the key areas that we've been working on in terms of all the CEPNs has really been looking to transform the nursing workforce. One of the things that was very apparent right from the beginning, which is backed up in all the evidence, is that there is a significant shortage of nurses working in the general practice workforce within those three boroughs. One of the key issues we faced in Bexley was that in fact when we commenced with the CEPN, actually there was no data at all on the nursing workforce, full stop. So as a starting point, the project manager undertook a training needs analysis, and that in itself was very helpful, not only in identifying exactly how many nurses we had within the workforce, but as it transpired, quite a few of those nurses actually held mentorship qualifications, which we had been unaware of up until that point. So immediately that enabled us to target general practices where those nurses worked. And as of September this year, we're now able to introduce those practices as part of the training circuit for pre-registration adult nursing students from the University of Greenwich.